Hello, everyone. I'm Mayor Phil Kramer. Thank you for watching. Before I start, I'm going to thank the people who helped me organize this. But while I do that, I want you to all get a pen and paper to write down some information that I'm going to be going over. For those of you on Facebook, I posted the information today, and it's titled Web/Phone Resources. It's also on the mayorkramer.com website, mayorkramer.com website. Some rules, or at least requests. You can make comments on Facebook, but please hold off until we call for questions. We want to avoid clutter, so just ask questions, not comments, when we're doing that, because Mr. Steinbrook is going to be trying to pull the questions off that come that way. You can also feed questions in through Tapped Into and the Franklin Reporter and Advocate. We have limited time, so we'll try to consolidate questions. We are considering doing this in a week or so from now. And after the meeting, comment if you prefer Facebook or if you'd like us to try Zoom. If we have technical difficulties, we will reconvene this tomorrow at 7. If my guests can't make it back by then, that's okay. I haven't heard her ring in yet. Do we have Freeholder Director Shanel Robinson? Okay, we'll get her later. I know Councilman Will Galtieri is on, Superintendent John Ravally, Manager Bob Vornlocker, Lieutenant Phil Rizzo, and then from the Franklin Reporter, Bill Bowman, and from Tap Into, we have Michael Lyons. So first, my thank yous. I'd like to thank Michael Steinbrook, who has done a huge amount of technical work to get this town hall meeting going and getting my Facebook up to speed. I now know more about groups and pages and profiles than I ever wanted to know, but I have to thank him for that. Ed Potasnik and Jessica Levine Sullivan also helped. Bill Bowman of the Franklin Reporter gave some technical advice as well. And I can't remember how it happened, but between he and Michael and I came up with this idea of doing this. Might have started with Bill. I'd like to thank Bill and Malik, Bill of Franklin Reporter and Malik of Tapped Into, for covering this. Donna Frazzo Lissi did a lot of work getting the word out. And then Councilman Wright helped as well. I'd like to thank the staff, Safi and Krista, for all the work they did getting this up. And then my wife has been acting as my staff and has resurrected my website, which is echoing my Facebook posts. So please tell people who don't have Facebook accounts but do have internet to go to mayorkramer.com. Okay, let's really start. Clearly, we are going through an unprecedented time. None of us ever expected anything like this. We all need to chip in and do our part. We've all heard much of what most of you have heard much of what I'm going to be talking about, but it's important to emphasize. Let's start with stay at home to the maximum extent possible. We need to flatten the curve. You don't have to leave. If you don't have to leave the house, don't. Work from home if it's at all possible. You can go out for walks or runs or similar things, but keep your social distancing 6 feet apart. If you witness people ignoring the social distancing at a particular location like a park, call the police. If you're in Franklin, the police are going to respond and they're going to get people to move on. If you believe a place of business is ignoring the governor's order, there is an online form accessible through the main page of COVID-19.nj.gov. That's COVID 19.nj.gov. And this is an incredible website. It has medical information, economic information, business information, legal information. They really did a good job putting this all in one space. And if you are looking for a job, they have employers who are looking for help. And if you are an employer, you can use that site to advertise for workers. There's also near the top in the center, there is a button that says feeling unwell. Check your symptoms. And you can go through an algorithm there. Don't be scared by the word algorithm. You just answer some questions and it will advise you what to do medically, whether you need to go to the hospital, whether you should stay at home, whether you're fine to go out. I really can't overemphasize this site. So if you want to report price gouging, call 973 504 6240. 973 504 6240. And again, you can go to my webpage or mayorkramer.com and you can get this information there under web and phone resources. If you have clinical questions, you can call 800 962 1253. That's 24/7. 800 962 1253. And then for general questions about the virus, call 211. 211. That's from 7 a.m. to 11 p.m. All right. Beyond staying at home, wash your hands. I mean, this is the rudimentary stuff, but this is the tools we have. Wash your hands. Don't touch your face. 6 foot separation. Cough it into your sleeve, or better yet, into a tissue, and then throw away the tissue. Clean and disinfect surfaces frequently. We all want to get our hands on hand sanitizer if you can't get it, but hand sanitizer isn't as good as soap and water, especially if your hands are dirty or greasy. Obviously, it's more convenient, but soap and water works better. My favorite post that I've done on Facebook, okay, excuse me, someone is actually calling me. Okay, my favorite post. Oh, thank you, Freeholder Director. Glad you're on. We'll let you talk in a little bit. So my favorite post on Facebook goes like this. You need to assume everyone you encounter has the virus. Everyone. You need to assume when you encounter anyone that you are a carrier and could infect them. So people are often asking me, is there a cluster in Franklin? Which house has the infection? I don't want to go near there. It doesn't matter. You need to assume everyone is infected and that you are infected but asymptomatic. They could spread it to you. You could spread it to them. People are urged not to go to the emergency room with mild symptoms. If you have symptoms, call your doctor first. They may want to have you come in when the waiting room is empty. The same applies when you go to the hospital. Try to call the hospital first. If you have symptoms and you can't afford a doctor, the nearest place that you might want to go is Zufall Health Center. That's ZUFAL. And again, this is all on the site and the page. 973-328-3344. 973-328-3344. And there's one located in Somerville. To find other ones, if you're watching from somewhere other than Franklin, there's a 24-hour hotline to find federally qualified health centers, and the number is 800-328-3838. The test for COVID-19 is free, and there's community-based testing. One of them is at PNC. In order to go, there are others that have been cropping up lately, run by counties. Those you have to be county residents. But for the PNC one and the one in Mr. Vornlocker, where's the other site?
Bergen County Community College.
Right, at the Bergen County Community College. For those, you must be experiencing cough, fever, shortness of breath, and by fever, 99.6. If you don't have those symptoms, they're going to turn you away. Bring proof that you're a New Jersey resident. If you're under 18, you have to have a parent or guardian. If you have a medical insurance card, bring it with you, but you're not required to have that. And you're going to show up. Individuals will drive through a secure area and will remain in their vehicles throughout the entire testing process. Be prepared for a long wait. No restrooms will be available, so bring any kind of comfort items that you need. Um, uh, so a curious thing about the virus that both Mr. Vornlocker and I have noticed is that a lot of our residents who are getting it are between the ages of 40 and that was my wife coming in. Yeah, between the ages of 40 and 59. So this may not be following the predictions that we've seen coming out of China. I've gotten a lot of questions about pets. It does not appear, the CDC says there is no evidence that pets can get infected. They can, however, carry the virus just as any object can have the virus on them. But it does not appear that your pets can be infected. Crowding at the supermarkets has come up. When you go to the supermarket, you need to wipe down the cart. Hopefully, the supermarket will provide wipes for you. There's been complaints about crowding. I have been in touch with one chain. One chain has been very responsive to me. It appears they are taking this into stride. I've hinted to them that I'm not predicting. I'm not threatening, but I'm predicting that if they don't take care of the crowding, that the government will, and they seem to be responding. Playgrounds are closed. Parks are open, but we have people looking for offenders who are not using social distancing, or people who are using the playground equipment. We had to take down the hoops of the basketball courts, which unfortunately now a single person can't go out there and play it because people were going out and playing. We've noticed teenagers gathering. Again, we are going to enforce the social distancing. Um, the municipal building is closed. However, there are people in there working. You can reach us by U.S. mail, phone, and email. Please be patient. We're on shifts or half staff at different times, so it's going to take a while to get to us. Please use our restaurants. We've posted on our website a way to find out which restaurants are open. This is the Township website. I've echoed it on my pages. Please try to use them. We've indicated which are open and whether they're doing delivery or pickup or both. Congress has passed bills to help people and businesses, but that's kind of beyond the scope of the Township. Please respect the senior shopping hours. At ShopRite, it's 7 to 8, and at Stop and Shop, it's 6 to 7:30. If you're immune compromised, you can go at those times too. Federal income taxes are delayed to July 15th. It's a bill is sitting on the governor's desk for him to sign to do the same. Daycare centers after April 1st will be open for the children of essential workers. The governor has ensured that your utilities will not be shut off during this. And to sum it up, I believe the township is in a squared away or as squared away situation as we can be. Government is operating as best it can under these limited conditions or trying conditions. And I think I'm now going to hand it over to Freeholder Director Shanel Robinson, who has been leading us through daily conferences, keeping the leadership of the county informed. Freeholder Director, do you have anything to say?
Nothing much more than what you've already expressed. I just want to encourage everyone to stay calm, follow the guidelines and best practices Mayor Kramer has outlined them on Facebook as well as on this evening's call. And the best defense that we have, since there is no medicine for this at this time, is social distancing. And as Mayor Kramer said, please be patient with government. And while our buildings are closed to the public, we are open for business to keep government running. However, with that being said, we are not at full capacity with our workforce. We know that when it comes to the concerns of the people, the human services, the recycling, the transportation, communications, as well as the economic turn or status or situation that we're faced with, we all are in this together. It is uncertain times, but if we follow the guidelines that have been set before us, whether you agree or disagree with what's out there, from the rock that we sit on, it is the most effective way that we can flatten the curve and come through this on the other side much better off. So just encourage everyone to stay in place as much as possible, not going out, only to take care of essential business, that is going to the grocery store. Wherever possible, they're asking retail businesses such as professional services to do as much online as possible within reason, and being able to provide social distancing if you had to do a face-to-face meeting to complete those transactions. There are a plethora of information. It's coming hard and fast, so always go to the links that are provided, validatedly, that are provided from the CDC and through the state. Please be aware of scammers, people exploiting us in times such as this, looking to go from door to door, saying they're census workers, or that they're checking on residents if they have COVID or not. No one is proactively knocking door to door. So please be aware and vigilant. And if you hear of anything or know of anything, go through the proper channels to report it. Again, we're in this together, and together we'll get through this. Thank you, Mr. Mayor.
Thank you very much, Freeholder Director. Councilman Will Galtieri has been doing a really excellent job on organizing our volunteers. I talked to him early on, and he just took the ball and ran with that. So would you like to talk about what you're doing, Councilman?
Can I interject real quick? Let me just interject real quick. This is Michael. I just wanted to ask people to hold off on their questions until the comments from the speakers are done. That way we don't have to get through. And if people are making comments, if you could refrain from making comments, it'll make it much easier for your questions to be read. Go ahead, Councilman. Sorry.
No problem. So thank you, Mr. Mayor. Yes. What I wanted to briefly touch on is that early on there were a bunch of groups that were all trying to come up with ways to help the town, and that's an excellent feeling to see everybody wanting to jump in. And what we were able to do is gather everybody into one group. It truly is a grassroots campaign of people coming together and donating their time to form. It's Residents Helping Residents, Franklin Township. That can be found on Facebook, and there is a website that it's at. It's facebook.com/RHRFranklin. And there you can find a link to the website to register to help if you're able to volunteer. We're also starting to open up, and we've got the form going for people asking for help. And really the initial intent is try to get people to help offset or help at-risk, the at-risk community of if you're able to order groceries from the supermarkets but not able to, you really shouldn't be in the store, then work with, that's a way to reach out to the group to set up for somebody to go and pick up. We're also starting to work with the food bank to try to do deliveries rather than having people all coming to the food bank and putting the employees there that are working tirelessly to try to help the community at risk also. and white, and there's others that I'm sure I'm missing, and it's not on purpose. It's just a lot of people stepped up in a short amount of time. So really, thank you to that group. The other initiative that's been announced today and has been over the past couple of days is the food bank really needs some assistance. So a virtual food drive has started. Thank you to the residents that have already stepped up and contributed in the emergency fund and now even in the virtual food drive. What this helps is allows the food bank to raise funds to go out and buy food, which there's a lot of people that we expect will need some help in the coming weeks. So if you have the means and are able to give $5 or $10, any help is appreciated. And then starting Monday, we'll be starting actual collections for the food bank rather than having them dropped off at the food bank itself. Again, to protect the employees, we're setting it up from 9 to 4 Monday through Friday at the Senior Center at 505 DeMott Lane. There will be a bin outside to drop off food, non-perishable items, and then Franklin Township employee will take them into the building and we'll get them over to the food bank. And but really, we're promoting the virtual food drive. But if you have anything to spare, also the big request is for peanut butter right now. That's another way to try to help out. But the volunteerism, we're going to try to expand as much as we can. But right now, we want to start small, just to see where we're at. And so far, the outpouring of support has been amazing. I think we have over 60 volunteers to date, and I think that number is increasing daily. So if you're feeling okay, the goal is not to have contact; it's contactless volunteers.
Okay, thank you, Will.
I think that's it, Mr. Mayor.
Thank you very much. Questions are rolling by. They're not going to get answered because we're not looking at that, and they're going to scroll off the screen, and we're not going to be able to get back to them. So please follow the guidance. Malik of Tapped Into asked a number of questions, and I'm going to go to them because he gathered questions from his readers. So he said, you mentioned last week that we want to shut things down for 2 weeks. However, I've not seen the state government provide any timeline metrics to help the public get a better understanding of expectations. Do I know why? Well, I don't have a direct ear to the governor today. We learned that he said the schools will stay closed at least till April 17th. That's not a hard date, as in that could be rolled back further. So we know that things are still going to go on, or expected to go on at least to April 17th, and probably will go on further. This is a fluid situation, and it's going to be changing all the time. We don't know what exactly is going to happen. So, but the best we know is the governor is expecting to stay till April 17th. What is the town doing to encourage residents to follow the shelter-in-place laws? I think Lieutenant Rizzo would be best to answer that.
We are actually, again, we're patrolling the parks, doing extra security checks, and just being out there and trying to keep our patrols vigilant while maintaining social distancing and trying to limit exposure to our officers. I have to say that overall we've seen a decrease with people being out, but we can never tell you enough. Don't gather in groups. If you're going to go to the parks, make sure you're staying with your social distancing. The fields are closed. Don't play soccer. We actually just had to break a soccer game up this afternoon. So again, just to get that message out of keep the organized sports away.
Okay, thank you. Number 3, in your opinion, as a medical professional, is it safe to buy takeout food, delivered food, why or why not? Why not? So food itself is safe, especially hot food. So that is safe. The problem is the packaging of the food. And there's actually, my sister-in-law found an excellent video of from a physician who shows you exactly how to unplate or how to plate food from a takeout, as well as how to deal with your groceries. So I posted that both on the mayorkramer.com. Actually, my wife put it there, and I put it up on Facebook. I think it's the top posting right now, and it'll show you how to do that as safely as possible. We all have to eat. Um, do you think we should limit how many people go to the supermarket at the same time? Well, I did. I did talk about that already, that the supermarkets are beginning to fall in line. If they're not, if you think there's not social distancing on there, you should call the police. You can let me know, but I'm just going to call the police. Um, let's see. Do you have numbers of how many people in our township have been laid off? He knows that Councilman Ram has an independent site helping with job listings, but is there more that can be done? Maybe Assemblyman Danielson can try to host a virtual job fair. So I spoke with Assemblyman Danielson about that. He is working on just that. Uh, uh, Dr. Ambasarian is posting about jobs. You can go to COVID19.nj.gov, COVID19.nj.gov, and you can, there are job listings there. And also, if you're an employer, you can list that you have job openings. As far as how many are unemployed in town, we never do just statistics at that. That's done at the national level and perhaps at the state level. How is the township helping our seniors? We just heard from Councilman Galtieri about that. What are the crime stats for this month? What is up? What is down? Lieutenant Rizzo.
So our call volume in general, our calls for service volume is actually down a great deal. A lot of that has to do with the fact that many people are following the stay-at-home order. Motor vehicle crashes are down, burglaries are down. Our calls for service are up, but the calls for service being up is indicative of our officers being proactive and calling out park checks and mall checks and the checks that we've created for the executive orders. But overall, our call volume has dropped tremendously, and that's really 100% because a good portion of the people are following the stay-at-home order and taking this seriously.
Okay, thank you. The last question is, if someone doesn't have a primary care physician and they have COVID-19, what should they do? Well, if you go to the website and the Facebook page, there is a post that we just put up. It's up near the top. You'll get a PDF on what to do if you have COVID-19. But basically, you need to call. If you don't have a doctor, you could call Zufall. I'm trying to get that number again. 1 second. And I'm not finding it easily. It is on the website, but you should call Zufall, and they can help direct you. The number is 973-328-3344. Basically, if you're mild, you're just going to be told to stay home. And if you're severe, then you're going to be asked to come into the hospital. Those are the main two choices that are going to happen. And Zufall can help you with that. And you can also go to COVID-19.nj.gov and take that test that they give you. It's up near the top, or you're feeling unwell, and that will help direct you to what you should do. I think that's it for the questions that I was asked. I did notice one question go by. Why aren't we telling you about clusters? So I have not been notified of any clusters. Um, it is not the place for the mayor to know about the locations of any single individuals. I think the health officer would notify me if we had a cluster, but so I'm not aware of any clusters. But I've emphasized it on my page. I emphasized it here before. You need to assume that everyone you come in contact with is infected, and that you are infected and asymptomatic, and then you might infect the person you come in contact with. So it doesn't matter if the house next door to you is infected. You need to act as if they're infected. Whatever choice you would make to do, if those people next door to you were infected, you should do that choice. Because even if they don't have signs, even if they're not, don't have and test positive, they very well could be positive. That's the insidious thing about this virus. So, okay, if we can now get some questions, um, uh, I'm ready to answer them. We can start with Mr. Bowman. Do you have any questions? Okay. Mr. Lyons, do you have any?
Sorry, I had it on mute. I had it on mute. No, I don't have any questions. Thanks.
Okay, Mr. Lyons.
No, you answered the main question, except for that last question that I had. I'm not sure if you wanted to discuss that. Maybe it would be something that would be done at the next council meeting.
Oh, right. You're right. I didn't. It was on the next page down. How are we with the quarantine and isolation ordinance? The next council meeting, we will be voting on it. I hate to predict votes, but I got a good feeling that this one's going to be passed. It was something that the health officer has requested, and I see, if I read the tea leaves correctly, it looks like it'll be a unanimous vote. But I hate to predict politics. Okay. Mr. Steinbrook, do you have any questions from the audience?
So I don't see too many here, but if people want to enter them now, and if other people could not comment, so there's a lot of comments, and we just want to kind of keep it to the questions so we can locate. So one was a simple one that people can answer: is it safe to go to the grocery store?
So, anytime you leave your house, there is risk. But obviously, you need to eat. Some of the grocery stores are doing shop from home, where they will do the picking of the groceries for you, and then they will. You can drive there. ShopRite put out a message that when you arrive there, there will be a way that you can text them, and they will then bring out the groceries to you. And then you can look at that video to see how to deal with the groceries once you have them home. But anytime you go out, there's a risk. If you go to the grocery store, 6 foot spacing, hand washing when you get back, etc. I went to the grocery store just the other day to see how how it was, and the gentleman came up to shake my hand, and I had to tell him no, I can't do that. So 6 foot spacing. Next.
So real quick, I just wanted to say, Jeff 11 Sullivan is commenting for us to keep a summary. If everyone else, again, could refrain, only ask questions. So one question was regarding construction projects. Somebody's building a house and we'll start working on the new roofs. So in terms of inspections and things like that.
Mr. Vornlocker.
Thank you, Mr. Mayor. So in reference to construction, the construction office is open for inspections. The executive order did not stop ongoing construction projects. If you have a project that involves a home that is unoccupied, the inspections can be scheduled via the normal means by calling into the construction office and scheduling an inspection. At this time, we are not inspecting work being done in occupied homes. The Department of Community Affairs at the state of New Jersey has granted extensions for all work that is done that would require an inspection in a certain amount of time in occupied homes. So while we're continuing on unoccupied structures, we will not be inspecting occupied structures.
And one question for Lieutenant Rizzo, I assume, would be, is the Franklin Township Police Department issuing ticketing, moving violations, that kind of thing?
As far as enforcing the laws, yes, we will continue to enforce the laws as we would for observed violations. Obviously, we're trying to limit the contact with the public as much as possible to put our officers at risk or the public at risk for that matter. So obviously for more minor violations, we may be apt to give a warning or just an on-the-spot type of admonishment there as opposed to other penalties. But yes, all laws are being enforced.
Sounds like a good idea. The other question was, can lawn services keep working?
Yes. They have to between themselves yes, they have to between themselves keep social distancing. Don't go out to tip them or greet them. Keep your distance, but yes.
Okay. If hopefully Superintendent Ravally is on, there's a question. Someone was curious about supplies that are in the schools and whether or not those were collected or donated, or if there was any resources that the schools were offering to healthcare professionals.
Thanks, Mr. Steinberg. Thanks, Mr. Mayor. And yes, the answer is we are doing that. I actually just sent a truckload of stuff over today that was surplus science gloves, some desanitizing wipes and some other things. And we'll continue to take inventory as supplies come in, and what we don't need, we will certainly send over.
Okay. And I assume for Mr. Vornlocker, are there new deadlines for property tax assessment appeal?
So I saw that question as well. I was going to bring it up when I saw a break. So the answer is we don't know. That's a decision that would be made by the state government. And if Freeholder Director Robinson is still on the line, that might be a good question to ask in your daily phone conference with the governor's office.
Duly noted.
Okay. And earlier in the thread, I did see a question which was answered by some folks in the thread, but basically people wondering if they could donate to the food bank and where they might do that. So that's an easy one at franklinfoodbank.org. So you can Google Franklin Food Bank or just go to franklinfoodbank.org. And I know that they have increased volume and they're working without volunteers, so they would appreciate any help you can provide. Maybe does anybody on the any of the speakers have any thoughts about other ways that people could make donations locally?
This is Councilman Galtieri. Today we sent out a request. So I am not trying to single out the food bank is the only organization in town that I know that there's others. So I have we have set out a town-wide message that if there's an organization doing stuff, please reach out to me and we'll get information out there as quickly as we can also and continue to update the list. But again, I would encourage, like you said, going to franklinfoodbank.org to do the which will help them buy groceries for families, and they're able to provide food to all different types of diets as well. The other option, as I mentioned, is as of Monday, we will start collecting non-perishable items for them at a new site at the senior center, 505 DeMont Lane, so that we can isolate the food bank workers from the public, just to keep them safe and healthy.
Mr. Steinberg.
Oh, sorry, I was off mute. Can somebody address the animal shelter operation and where they're at right now?
Mr. Vornlocker?
Sure, I can do that. As most of you or some of you may or may not know, the animal shelter does fall under the police department, and it is under my division. They are currently closed to the public, but under reduced staff, and they are operating. They are in every day. I can assure you that the animals are well taken care of, and we've limited our volunteers through Second Chance and Angel Tales, the two nonprofit organizations that assist the shelter in their operations. We've limited contact with those individuals by doing volunteering on a signed-up basis only. This way we can ensure that the animals are cared for, but we don't have too many people, and we're able to maintain social distancing and still maintain the animals. They are accepting donations still. The donation box is out in front of the shelter, so any donations could be dropped there.
Okay, one tag on.
Actually, before you go on, I was just reminded,
Yep.
I didn't do a shout out to Jonathan White. The original idea that led to Residents Helping Residents was Jonathan White's idea. And then I asked Will and Rich, and Michelle was already doing it, and it just took off. Michelle actually was a day ahead of us, but he deserves that shout out. Go ahead, Michael.
Okay, great. So the question was just with regarding ticketing, but with regard to social distancing guidelines and enforcement of that, how is the police force handling it?
We are obviously going to follow the direction of the county prosecutor and any direction that they would provide from the Attorney General's office. At this point, we do have the ability to summons. Luckily, we have not had to do that. Anyone that we've encountered has been very cooperative and understanding, and we're trying to deal with this more on a community policing level. But if it did get to that level where we did have to issue a summons, we are prepared and could do that.
Okay, and a question. There's really two questions for you, Mr. Mayor. One, with concern regarding xenophobia and any kind of backlash against Asian Americans, given that some are using language that may kind of create a kind of toxic environment around that issue.
I think that's horrible. It's ridiculous. And right now, we have more cases than China, so we are the people to be worried about. Florida is thinking of banning New Yorkers from coming or making them quarantine for 2 weeks. If this started in China, and it does seem that it did, no person you're meeting had anything to do with it. That's just raw bigotry.
Or any person, period. So the other question, as Mr. Ray, as you've seen online before, and I think it's hard to address, was the question of the number of cases that are identified in Franklin as compared to neighboring municipalities. So if you want to address that.
I mean, why are we higher than the neighboring ones? Well, the main reason is that we're 1/6 of the county, so we're going to have bigger numbers. That we have more density than other parts of the county and parts of our town too. If you put up a map of New Jersey and it had these purple circles on it, and what you notice is the closer you are to New York City, the more likely you are to have a bigger circle. There's a circle for each county. But also you'll notice that the denser counties or the more populated counties had bigger circles. So we don't know of a Franklin issue other than we are big and there are dense areas. That's the only reason I can think of it.
Okay, and there was also a question, aside from donations of financial donations to charities, any donations of supplies to either the animal shelter or other groups? I think there was some mention earlier about peanut butter and residence to residence, but I'll let Will or somebody wants to, or Councilman Terry wants to answer that.
I'm sorry, what was your question?
Just a question about actual goods being donated or supplies being donated, and any to the animal shelter or to other charitable organizations.
Yep. Again, so animal shelter I know is there is was mentioned the drop-off box in front of the facility. As far as goods or food for the food bank, we've organized that the drop-off will be at the municipal complex. And then as I hear from other organizations, then we'll start figuring out other setup points. It might be as simple as just having tables set up in the senior center, since we've got the large room that's empty right now, that we organized one for the food bank and one for other items. But, yep, absolutely.
Okay. And there's the question, concerns about the welfare of our neighbors who are living in nursing homes, assisted living facilities. Is there any information we have with regard to their welfare?
There's another question that I'd also like to ask, Michael. This is Bob Vornlocker, but I can touch on this.
Yep.
The nursing homes and assisted living facilities all fall under the licensure of the Department of Health. We have contacted all of them through the Emergency Management Office to ensure that they are doing what they need to do, and that they have the guidance from the Department of Health, both locally at the county level and at the state level. So that we don't have any direct control over the nursing homes or assisted living facilities, but we certainly have reached out to them to make sure that they're aware that they can contact us if they're in need, but also to make sure that they are understanding of all of the guidelines coming out of the State Department of Health. The other question I'd like to ask to answer, though, and I think it would be Councilman Galtieri, is Marie Fiorello, before you tune out, the answer to your question about groceries being delivered from markets to your 85-year-old mother, I think Councilman Galtieri can answer that question.
Yeah, thank you. I was going to jump in with that one also. So that is, and Jonathan's been posting also, I see at the same time, that is the whole reason we started Residents Helping Residents. Just fill out the group of I need help. Don't just go order groceries for your mother or relative or whoever it may be without reaching out to the group first. But the goal is that if you have a means to order groceries for them for the shop at home, but we acknowledge there's limited deliveries at the stores, and it's just simple manpower at the stores to handle it. So that is the goal. They are accepting, from what I understand, they're still allowing orders to be picked up. So this would be the perfect opportunity to go to the Facebook group, go to the website, fill out a form, I need help. The group will reach out to you and organize, and we'll start working on a way to grocery. One of the things I want to mention though is we started this approach so that the transaction is solely with the store, and that was under some advice from both the chief of police and some other agencies. There are groups that we know of that have started in other areas where people do the shopping. We're trying to avoid that right now as much just so that really the transaction is between the store and the customer or the resident, and then it's just somebody picking up food and safely delivering it to the front door without really making contact. Or if you have a garage, you can open the garage door and they can drop it in the garage and then close the door as they leave and figure it out. It's whatever your comfort level is. But really, this is designed to be contactless delivery. But please take advantage of please reach out to the group, to this group that's been started. This is the whole reason that it was started, to make sure that we account for residents that can't get out.
And so, thank you. And so, Superintendent Ravally, there's some questions about how things are going with the remote instruction of students, also about student access to laptops, student internet access. I know there are internet providers that have offered that for free, so we're wondering if that's been tracked. And then I'll have a follow-up just advice for parents, because I know parents have had some questions about just things that they can do, with their students, with their children while they're home.
Sure. Let me first say that, if I may, all of our information is on our district website if you're able to access it. And it will talk about our remote learning plan, which is built in the first 12-day cycle. Remember, we've only focused on the first 12 days. We're building the second 12 as we speak, and more information will come out about that next week. But for the first 12-day cycle, that was really learning packs, and there is access to those learning packs online, but all of our students, for the most part, were sent home with the learning pack paper copies our last day of school, March 13th. In preparation for cycle 2, we have rolled out, and we had additional opportunities for, we've been dealing with our learning community via our blast messaging and through our principals, and we had opportunities for picking up laptops for students and families that were without devices. And since beginning that process after we had closed school doors and up and through what will end on Friday, we'll have put out almost probably close to another 1,000 devices in student hands. So we've been constantly surveying and have a pretty good handle on those that have internet access, those that needed devices, and again, we're able to get devices in people's hands. If you're still having a problem with access, you certainly do want to contact your building principal, and you can do that by calling your school, leaving a message. Our principals and our staff, although they may not be physically in the building, they're working every day, and they are in fact checking messages, and they'll reach back out to you when distributing the laptops. And we have a whole section on our website as well that speaks to connectivity, speaks to instruction technology resources, speaks to all kinds of additional activities you can do with your kids via technology. If you look on our website, there's an instructional technology resource section on the remote learning plan information portion of the site with a plethora of information regarding additional kinds of learning activities for kids. So we feel pretty confident that it's going pretty well. We're checking in with our teachers. We're working, we have about 35, 40 different principals, assistant principals, supervisors that are working directly with our teachers, and all reports are that, it seems to be going pretty well. And our teachers, as always, have stepped up to the plate and are doing some really wonderful things, being very creative. So we're looking forward to, if we have to, our second 12-day cycle, which would begin after spring break, and we're thinking that may even include some more exciting technological kinds of things with backup if technology access isn't possible. That will start to push learning even a little bit further. So that's where we're at. And what was the follow-up, Mike?
I think it was just whether or not there's a resource or place we can direct people for parents
parents who are just kind of looking for ideas for things at home beyond what's happening with the online curriculum? Yeah.
Yeah, so the best way is to, like I said, if you click open to our website, obviously if you're looking for technological resources, you'll have website access. If you go to our website, you click the Remote Learning Plan Information tab. When you get to the Remote Learning Plan site, you're going to see all kinds of different things that you can do, all kinds of different information that's there, and more importantly, there is a plethora of additional technological resources. There's a link for that. When you click that open, it'll give you all kinds of things that you can do. It's unlimited. So iReady, linkage stuff, Clever, symbolic stuff, all kinds of opportunities. And then there's also the information about the Comcast. My understanding is through our instructional technology folks in the Office of Instructional Technology, Comcast has an opportunity where they're offering 2 free months and then a very low subscription for what my folks are telling me is pretty good bandwidth after the 2-month period. So it's something you may be interested in looking at, and that's called the Comcast Essentials package. And we put that online too because it is free for 60 days, which would likely carry you through any point of closure that we might have.
Yeah. Dr. Ravally, if you could just repeat the website for people.
Sure. You go to our main page, which is franklinboe.org, www.franklinboe.org. When you get to our main page, you can't miss it. It's the first link there, and it says Remote Learning Plan, and you click on that Remote Learning Plan, and it'll take you to our main site that has all of the information on it about the Remote Learning Plan. It has the modules there in case you lost something, you can reprint it. It has additional resources. It's both Spanish and English. Talks about our free meal delivery plan, the sites where we're offering meals on Mondays and Thursdays. Frequently asked questions are there, and our student accountability rubric is there, which will change during the second 12 days, but for the first 12 days it's there. And then again, the additional technology resources are there as well. So www.franklinboe.org.
So there's
and real quick, Mr. Go ahead.
So there was a question I saw. If someone sees someone on the closed county golf courses, what do? You call the police. There was another question about where are the infections coming from. Well, the first infection was a gentleman who had traveled to Italy, and he came back and managed to get through the screening, probably appropriately, but then became sick afterwards. I do not think he's patient zero for here. I think New York City is a place where people congregate. There are a lot of foreign travel there, people from all over the coast coming there, and then those people or people from here work there. But where these cases are coming from now, they're coming from here. It's here. It is community acquired now. We are not able to trace where people get things. So it is here. It is amongst us. That's the sad news, but that's where they're coming from. Again, assume everyone you encounter is infected. Go ahead, Michael.
Okay. Real quick, our friend Bob Laporte had a question about donation of blood and the need for blood donation. If we have that information. If not, we can get back to people.
What was the question?
So this is Lieutenant Rizzo. They actually talked about that today in our daily conference call with the OEM coordinators. And what you should generally do is contact I know in the Somerset section what they were saying, or the Somerset Blood Council, what they were doing was having you call in to make an appointment. And they are accepting donations, but they're making sure that you have appointment times, and they're only allowing 1 or 2 people in at any given time, and they're requiring you to wear masks. They're screening you for fever and so on before you come in. So just contact the local hospitals to see if they need it.
And I just want to add to
So,
that, according to the CDC,
Go ahead.
this is not a blood-borne disease. The blood supply is safe. There's no known transmission through a blood transfusion. Go ahead.
So if we, obviously we can't speculate, but if anybody has any direct information about how our local hospitals are faring.
I don't have that information.
Okay, and then you may not have this either. But was a question about if a child, with COVID-19 requires hospitalization, then visitation from family would not be possible, or do we not have that information?
I do. That's up to the hospital.
Mayor,
Yes, ma'am.
Mayor,
Go ahead.
I can speak to that a little bit. And I'm an employee of St. Peter's Hospital. I am not a spokesperson for St. Peter's, but I can just tell you what's happening there in a general sense, and then also Robert Wood Johnson Somerset, which is formerly known as Somerset Medical Center. So just like everybody else, even the test site, PPE, which is personal protective equipment, is what everybody is searching for. The emergency rooms in the beginning in hospitals during the first week were busting at the seams. You have your frontline staff who are working very hard to make sure that the patients are taken care of. But if this continues the way it's trending and we don't flatten the curve, not to alarm anybody, but the protective equipment will be crucial and critical in the care of those patients who are moderate to severe, who require hospitalization. I would just encourage everyone, just like with anything else, because the regular flu, unless you're dire or severe in your symptoms, most people stay home and they press through it. And then they go to emergency rooms when it's necessary or needed. This is no different. People are running to go to the different testing sites because they just want to know if they have COVID, if they test positive for COVID-19 or not. However, this is why social distancing and staying shelter in place is very critical in flattening that curve and slowing this down.
So Freeholder Director Robinson, if I could have to follow up, if you have any information, countywide or in Franklin, and maybe Mr. Vornlocker could help, or Lieutenant Rizzo, in terms of personal protective equipment for local first responders of any kind, and any supply issues there.
I'm going to defer to Rizzo or even Vornlocker to respond on behalf of. They've been in more constant contact with OEM, and the municipal OEM is working with county OEM. So.
Okay.
So I can actually take that. As some of you know, I am also a deputy coordinator of emergency management for the town. We have been in constant contact, daily contact with county OEM and the state. My office has procured some personal, the PPEs, and right now we have stock. But as the Freeholder Director stated, if this were to reach a critical point, those supplies would be severely limited and we would burn through them relatively quickly. So we are working with county OEM, and county OEM has done some procurement, and it's just an ongoing process where we continue to procure a resource that everyone is trying to get. But right now we are in pretty good shape.
Okay, great. And there's a request, Mr. Mayor, maybe to kind of up your volume a little bit. And then there was the question about supports for resources for supporting small businesses.
So, Mr. Mayor, I can take that. So I did see the question, actually. I was going to ask you to bring it up, Michael. So the question about support for small businesses, NJEDA programs, DCA programs, and the like, there is on our website resources for local businesses affected by COVID-19. It's in the spotlight on the main page of the Township website. It brings you to links specifically related to the response to the COVID-19 pandemic by the U.S. Small Business Administration, the state of New Jersey EDA, and then also interim guidance for business and employers from the CDC, assistance from the Somerset County Business Partnership, and the New Jersey Department of Labor. So all of those links are in the spotlight on the title Resources for Local Businesses.
Okay, great. And I'm down at the end of the thread. I can't promise I didn't miss some questions along the way. I did see a couple of things I think we addressed a little bit, but just referencing what our local grocery stores and supermarkets are currently able to do in terms of delivery, curbside tech. You know, anybody has an update on kind of where things are with that?
I only know because my wife looked at that and for ourselves, and she noticed it was several days out, and they were only booking for X amount of time, which was several days out, and you couldn't book beyond that. So she's waiting till tomorrow to book. We have no direct control of that. Will, can you help with that in any way? Is your organization able to help with that?
I'm sorry, I missed part of it.
So they were asking about ordering from home and then picking up, and the order from home is booked out a fair distance. Are you able to help with that at all? Are you set up to do that?
So we can follow up with the stores to see what their needs are. I know early on we had discussed other options if there's something that the stores would are comfortable with. So it all comes down to if the stores can handle or not. But it's something I can definitely follow up on and see what we can do and how we can assist with that. So if somebody does have the need, again, they can go to the group or go to the website that's been posted a couple times and fill out a form. I need help, just so we identify who it is, and then we'll start seeing what the stores can do. We're really trying to avoid the going shopping, being a personal shopper for somebody just because of the risk all around. But if that's something we need to explore that hasn't been taken off the table as a possibility as well. So I will definitely follow up on that.
Okay, and I can get you the contacts that if I haven't already, for the people at the supermarkets, the managers.
Yep. And if anybody else there has a question, again, that got skipped, as I'm kind of scrolling through and trying to keep up, if you want to repeat it, but at present, I think we've covered it. Maybe if there are any questions that any of the presenters still have in their pocket that they wanted to address, now would be a good time.
Well, my wife did wants me to remind people that we're going to do our best to download this to YouTube, and we are going to put it up in as many places as we can. And then I plan to do this again next week. Stay tuned for where. I've noticed a few people having difficulty with the technology. We're going to look into Zoom instead, but that has its limitations too. So the internet's being stressed as well.
Yeah, I think those are household issues in terms of broadband or area issues, but it seems like everything's working fine in regard. But we certainly can try Zoom. There is a couple questions about our favorite topic, which is toilet paper, in any way to get alerted to the availability of it. Obviously, people throw that up in groups on Facebook quite a bit. By the time you get it, it's all gone. So any ideas on that?
Yep. Stop hoarding toilet paper. I don't.
Amen.
I don't get it. Mr. Vornlocker actually had the theory that all started in Australia, who got their paper from China, and the internet being what it is and social media, that it leaked over to here. I don't understand it. Relatively few people get diarrhea with the virus. Yeah, we don't want to run out of toilet paper. I'm going to be a little bit gross here, but if you run out of toilet paper, you want to conserve toilet paper, take a shower. Stop hoarding toilet paper, please. I'm sure the stores are looking for it. They've got some off-brand names there. I just wanted to give a shout out to Jessica Levin Sullivan. She's doing an excellent job of summing up. I appreciate that very much. And hello, Michelle. Thank you for the work you're doing.
And I appreciate it even more because it saved me the trouble. So thank you.
So, Mr. Mayor,
I'd just like to say, Mr. Mayor, thank you.
this is definitely a good time to fill out the census if you haven't already, since everybody's home. I was able to do mine in just a few minutes, so take this opportunity while you're home to just fill that out to ensure that we get the resources needed in the coming years.
Freeholder Direct, thank you,
Mr. Mayor?
Councilman. Freeholder Director
Mr.
was
Mayor, do you think
next.
we could do a quick closing round?
Sure, that's a good idea.
Brief comments?
Let's start with the Freeholder
Okay, so
Director.
I heard, yeah.
Yes, Mr. Mayor, I just wanted to applaud and commend you and the team that you're working with. I'm not going to name everybody by name, but I just want the residents of Franklin to know that your leaders, your community leaders, and your elected officials have been on it and actually working bipartisan to bring some of these things to light, to making sure that Franklin Township is safe and well. So we have a jewel in Somerset County, and I can tell you in comparison to the other counties, Somerset County is doing pretty well.
And I want to thank you.
Mr. Mayor.
I want to thank you for that, Freeholder Director. You've shown great leadership throughout this. Let's see, Councilman Galtieri.
Just again, everybody, please be patient. I know this is trying times, so if you're able to volunteer, please sign up. If you need help, we're trying. I can't promise anything. What I can say is send in some information. Our volunteers have been doing amazing things over the past week alone to try to get the resources available. And if you, I know things are really tight financially for a lot of people, but if you have the means, please try to consider donating to our lifeline, our community organizations that are the lifeline for those that might be struggling in the week to come. But thank you everybody that stepped up so far, and please, if I don't mean to single out any organization, so if there's somebody out there providing help, please send it over. We will try to get you posted and see what we can do to support you as well. So, and thank you everybody for joining tonight.
You're welcome. Thank you. Superintendent Ravally.
Yes, thanks, Mayor, and thanks for the invite. I just want to let everybody know there's lots of information on our plan, as I said before, on our website. So please access the website, and if all else fails and you can't find the information you're looking for, if you call your child's school, someone from that school will, most likely be your principal, but somebody will call you back with the information that you're looking for to answer your question. So again, www.franklindoe.org, and if all else fails, call your child's school and your principal will make sure you get a return call back. Thank you.
Thank you, Superintendent. And I called him late in the making of this, and he, as he always does, bent over backwards to make himself available. So I wanted to thank him for that, and I'll do better next time for you, John. Manager Vornlocker.
Thank you, Mr. Mayor. So I think everyone has covered all of the things that our community is doing. So what I'd like to do is thank the staff of Franklin Township who work for me. They are doing a fantastic job in times of really great anxiety among all of us. All of our offices continue to be staffed, our police department, our public works department. Obviously we're somewhat short-staffed in each department daily so that we can protect the employees and try to minimize their risk. But we continue to staff government, maybe a little slower than normal, but we're still there every day. And we're still providing the services from the IT department, maintaining the website, to, like I said, public works and clerk's office and fire prevention and all of the other offices. They're doing a fantastic
I always hate to compliment Mr. Vornlocker in public, but and that's actually not true. He is doing incredible work. He's getting in at 6. He's handling calls till he falls asleep on the couch. He's doing an incredible job, and I want him to get more sleep so he stays well because we need him. Thank you, Mr. Vornlocker. Lieutenant Rizzo.
Thank you, Mr. Mayor. First, I'd like to thank the men and women of the police department because they are working tirelessly around the clock to make sure that our community remains safe during these trying times. Our communications officers, again, the telecommunicators that answer your 911 calls, we staff that room 24/7, 365, and they too are first responders, unsung heroes that we never hear about. And I'd also like to thank the people of Franklin because they have been cooperative with us and they're assisting us in keeping the community safe. And I know these are difficult times, and I just ask that your continued patience and cooperation with our officers during these trying times. And I've been here in the township now for almost 24 years, and I'm fortunate to say that this is a great community, and we always come together during the difficult times, and I don't anticipate that this is going to be any different.
Great. Let's see. Bill Bowman.
No, I have nothing to add. Thanks very much for your time.
Okay. Mr. Lyons.
Thanks, Mayor Kramer. All I wanted to do is just let any small business know that Tap Into as a whole will be allowing advertisers to advertise for free to get any message out for your business, and that goes for local organizations like any not-for-profits or anything like that. We want to help you to spread your message of what you're trying to do right now in these very difficult times. Thank you, Mayor Kramer.
Thank you. Michael?
And well, what I wanted to say, just thank you to both Bill Bowman and Malik Lyons for helping us get the word out about this event, and also to just remind people that if they could try and bring people to the mayor's Facebook page in an effort to get them direct and uncluttered, accurate information on COVID-19 and related matters. You know, there's a lot of disinformation happening. The governor has, kind of passed on information that we're seeing federally. And, when I look at the feeds, there's a lot of different things that are confusing people. And as we go forward, we're going to need people to really kind of step up and keep the accurate information in front of people's eyes, as we get through some trying times. So
Okay.
that's pretty much it.
Thank you. I did see a question.
Mayor,
One second.
Yeah.
I did see a question from Ben Guy about small businesses. So you could go to COVID-19.nj.gov, and they've got it, but you can also go to CV as in coronavirus, .business.nj.gov, CV.business.nj.gov, and they've got a lot of small business information there. Go ahead, Michael.
I was just going to say we haven't really officially launched it, but we did create a group that we anticipate we may need for, which is Franklin Direct. So that's one word. Franklin Direct is a group that we'll be able to. We're going to be trying to bring people to, and one of the benefits of that, should we need it, is that people can get all posts in front of them, and we also have some other ideas. But that's just at Franklin Direct on Facebook.
All right, I guess this concludes it. I want to thank again everyone who helped. That's all I got. I've said it before at the end of every council meeting. I'll say it now, and I really mean it. It's taken on a new meaning. Be well, Franklin. Bye-bye.